Bone pain is one of the most misunderstood signals of the human body. Many people assume that pain in the bones is simply a sign of aging or temporary weakness. But in reality, bone pain develops through a slow and complex biological process. Bones are living tissues. They are constantly rebuilding, repairing, and adapting to stress. When this natural balance is disturbed, pain begins to appear. The earliest stage of bone discomfort often starts deep inside the bone structure, long before severe pain is felt on the surface. This is why many individuals ignore early symptoms, believing the discomfort will pass on its own. Bones rely on a steady supply of minerals, oxygen, blood flow, and hormonal balance to remain strong. When any of these factors decline, bone tissue becomes sensitive. Microscopic cracks can develop within the bone matrix. These cracks are not fractures, but they weaken the bone's internal structure and trigger pain receptors. Over time, this internal stress leads to inflammation inside the bone marrow, which further intensifies discomfort. Bone pain is different from muscle pain. It is deeper, more persistent, and often worsens at night or during rest because blood circulation slows down during inactivity. One major reason bone pain develops is reduced bone density. As bone density decreases, bones lose their ability to absorb impact and pressure efficiently. This causes everyday movements, such as standing, walking, or even sitting, to place abnormal stress on the skeletal system. Another critical factor is reduced calcium absorption. Even when calcium intake seems sufficient, poor absorption, due to digestive inefficiency or hormonal imbalance, can lead to mineral deficiency. Within the bone tissue, vitamin D also plays a crucial role as it regulates calcium movement into bones. Without adequate vitamin D activation, calcium remains unused, leaving bones weak and painful. Inflammation is another silent contributor to bone pain. Chronic low-grade inflammation interferes with bone remodeling, the process where old bone tissue is replaced with new tissue. When inflammation dominates, bone breakdown exceeds bone formation. This imbalance results in thinning, bones that become sensitive to pressure and movement. Hormonal changes also influence this process. Hormones such as estrogen, testosterone, and cortisol directly affect bone strength. When these hormones decline or fluctuate excessively, bones lose stability and become prone to pain. Nerve involvement can also amplify bone pain. Bones contain nerve endings, especially within the periosteum, the outer layer of the bone. When this layer becomes irritated due to mineral imbalance, inflammation, or reduced blood flow, pain signals intensify. This is why bone pain often feels sharp, deep, or aching in nature and does not respond quickly to rest alone. Ignoring these early signs allows the condition to progress silently, increasing the risk of long-term skeletal damage. The most important medical advice at this stage is awareness. Bone pain should never be dismissed as normal discomfort. It is a message from the body that internal bone health is compromised. Addressing this signal early can prevent further degeneration and restore skeletal strength through proper nutrition, movement, and metabolic support. Bone pain does not develop overnight. It is the result of long-term physiological stress placed on the skeletal system. One of the most critical contributors is nutritional imbalance. Bones require more than just calcium. They need magnesium, phosphorus, vitamin K2, vitamin D, and trace minerals to maintain structural integrity. When one nutrient is missing, the entire system becomes unstable. For example, calcium without magnesium leads to stiffness rather than strength. Vitamin D without vitamin K2 can cause calcium to deposit in the wrong tissues instead of bones. This imbalance gradually weakens bones and leads to discomfort that worsens over time. Another significant cause of bone pain is poor circulation. Bones depend on blood vessels to deliver oxygen and nutrients. Reduced circulation limits the bone's ability to repair itself. This often occurs due to inactivity, prolonged sitting, or metabolic slowdown. When blood flow decreases, waste products accumulate inside bone tissue, increasing inflammation and sensitivity. This is why bone pain often feels worse during long periods of rest and improves slightly with gentle movement. Acid-base imbalance within the body also affects bone health. When the body becomes overly acidic due to poor dietary habits, stress, or dehydration, it draws minerals from the bones to neutralize acidity. This protective mechanism weakens bone structure over time. As minerals are stripped away, bones become porous and fragile, leading to pain and increased sensitivity. Hydration plays a crucial role here. Without sufficient water intake, mineral transport slows down, further compromising bone strength. Another overlooked factor is chronic stress. Stress hormones, especially cortisol, directly interfere with bone regeneration. Elevated cortisol levels slow down bone formation and accelerate bone breakdown. Over time, this hormonal environment makes bones thinner and more prone to pain. Sleep deprivation worsens this effect. During deep sleep, the body releases growth hormones that support bone repair. Poor sleep disrupts this process, preventing bones from healing properly. Postural imbalance and improper movement patterns also contribute to bone discomfort. When posture is misaligned, pressure is distributed unevenly across the skeletal system. Certain bones are forced to carry more weight than they are designed for. This constant overload causes microdamage within the bone tissue. Without adequate recovery, this damage accumulates and manifests as persistent pain. Proper alignment and balanced movement are essential for distributing stress evenly across the skeleton. Medical guidance emphasizes consistency rather than quick fixes. Bone health improves gradually through daily habits. Regular exposure to natural sunlight supports vitamin D synthesis. Balanced meals, rich in minerals, provide the raw materials for bone repair. Gentle weight-bearing activity stimulates bone formation without causing damage. Stress management and quality sleep allow hormonal systems to stabilize, supporting long-term skeletal strength. Bone pain is not simply a symptom to suppress. It is a signal that internal systems are struggling. Addressing the root causes restores balance and reduces pain naturally over time. Effective management of bone pain requires a structured and disciplined approach focused on strengthening the skeletal system from within. Pain relief alone is not sufficient. The goal is to rebuild bone resilience and restore normal biological function. The foundation of this process is mineral balance. Calcium intake must be adequate but properly supported by magnesium and vitamin K2 to ensure correct absorption and placement within bones. Vitamin D activation is essential, as it regulates mineral movement and supports immune function within bone tissue. Timing also matters. Bone regeneration is most active during rest, particularly at night. Ensuring proper nutrient availability during this period enhances repair mechanisms. Evening meals should include mineral-rich foods, while caffeine and excessive sugar intake should be minimized, as they interfere with mineral retention. Hydration throughout the day supports nutrient transport and waste removal, reducing inflammation within bones. Movement is another critical component. Bones respond positively to controlled stress. Weight-bearing exercises stimulate osteoblast activity, the cells responsible for building new bone tissue. This does not require intense training. Consistent, moderate movement sends signals to the body to strengthen bone structure. Prolonged inactivity weakens bones, while excessive strain causes damage. Balance is key. Inflammation control is essential for reducing bone pain. Chronic inflammation disrupts bone remodeling and increases sensitivity. Anti-inflammatory nutrition, proper sleep, and stress reduction work together to calm the internal environment. Omega fatty acids, antioxidants, and adequate protein intake support tissue repair and reduce inflammatory markers that contribute to pain. Hormonal stability must also be maintained. Balanced blood sugar levels prevent cortisol spikes that weaken bones. Regular sleep patterns support hormone regulation and bone regeneration. Exposure to natural light during the day and darkness at night reinforces the body's natural rhythm, which directly influences skeletal health. Medical advice emphasizes patience and consistency. Bone tissue regenerates slowly. Improvements in pain and strength occur gradually but steadily when the body is given the right conditions. Short-term solutions often fail because they ignore the complexity of bone biology. A long-term approach restores strength, reduces pain, and prevents further degeneration. Bone pain is not an inevitable part of life. It is a reversible condition when addressed correctly. By supporting mineral balance, circulation, hormonal health, and controlled movement, the skeletal system can regain resilience. Listening to the body's signals and responding with informed care leads to lasting relief and stronger bones over time.